Edutainment Studios welcomes you to colon cancer. This module is part 2 of a 3-part series. Colon cancer is not typically a comfortable topic of conversation. However, it is the third most common type of cancer in the United States and affects approximately 140,000 people every year. In this course, the objective is to help you recognize the signs and symptoms of colon cancer, list some of the screening procedures, and define the different stages. Polyps that have turned into colon cancer or colorectal cancer can have little or no symptoms in the beginning stages and can go unnoticed for years. This is why it is so important to get regular screenings to identify and remove polyps before they become cancerous. Part of the prevention process will start with a doctor taking a medical history and performing a physical exam. The exam may include checking your abdomen for masses or a digital rectal exam. This is also known as a DRE and will involve the doctor examining your rectum with a gloved finger. Testing usually starts with a colonoscopy, which examines your entire colon and rectum. A sigmoidoscopy may be ordered as an alternative, which examines the lower portion of the colon, sigmoid, and rectum, or a proctoscopy, which just looks at the rectum. This is typically performed if rectal cancer is suspected. Biopsies may be taken during these procedures to view suspicious tissue under a microscope. A fecal occult blood test, or FIT, may be appropriate, as it tests for blood in the stool that is not visible to the naked eye. FIT only detects human blood from the lower intestines. The doctor may then order blood tests such as a complete blood count, CBC, which can show signs of anemia, liver enzymes as it can spread to other organs, and tumor markers. X-rays, CT scans, and MRIs have also been utilized in some cases. If symptoms do appear, they are usually related to gastrointestinal issues such as diarrhea, constipation, nausea, or vomiting. You may also experience abdominal pain, frequent gas pains or cramps, a full or bloated feeling, and unexplained weight loss. The most common telltale sign of having polyps is rectal bleeding or blood in the stool, which can eventually lead to fatigue and weakness from iron deficiency anemia. All of these manifestations can alternatively be signs of many other medical issues. If you have concerns in any one of these areas, speak to your doctor immediately. If all tests and procedures lead to a cancer diagnosis, it may be comforting to understand that there are 5 different stages of colon cancer. Stage 0 is where the cancer is contained just inside the lining of your colon or rectum. In Stage 1, the cancer has grown in or through the lining of your colon or rectum. If the cancer has grown through the wall of your colon or rectum, it is classified as Stage 2. Stage 3 consists of the cancer spreading to the nearby lymph nodes. In Stage 4, the cancer has spread to other organs, such as the liver or the lungs. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 2 of this 3-part series on colon cancer, and come back for part 3.